This is a cured case of brain abscesses. Let's see how the case is taken, perceived, treated, and finally cured with homeopathy. On January 12, 2024, I received a call from a friend who often refers complicated cases to me. He asked about a relative who was very ill. The patient had a severe headache and had lost vision in his right eye for several days. An MRI report revealed that he has abscesses in his brain. Neurosurgeons at General Hospital Lahore were consulted and they recommended opening the skull to assess the situation, but they could not guarantee a positive outcome. So the patient's family was very scared because nearly a year ago, a young man they knew had died of the same disease after remaining in a coma for several days following surgical intervention. The patient had young children and the family did not want to risk surgery. My friend asked if this case could be treated with homeopathy. I asked him to send me the MRI report. When I saw the report, it confirmed the presence of abscesses in the brain. You can see the report on the screen. I then told him that I would need complete A to Z details of the case to determine whether it could be treated with homeopathy. When I went to see the patient at his home, his condition was very bad. He had not taken any food for 2 days, was moaning due to severe pain, and could not get up or move about. He could not even move his arms due to extreme weakness. Even speaking was difficult for him. Observations. He was lying in bed covered with a quilt and a blanket, wearing a sweater and a leather jacket with a warm cap on his head and a scarf wrapped around his ear and neck. He had been almost senseless for 2 days, neither talking nor eating. His uncle called him 2 or 3 times. He answered with great difficulty. His uncle told him, "Doctor has come to check you. Please explain your complaints to him." The patient did not answer. Then I addressed him by his name. He uncovered his face with great effort and gave the following details. Number 1. I feel very weak. I can't get up and I can't move my limbs. Number 2. There is pain in and around my eyes. Number 3. My vision has been lost for nearly 15 to 20 days. I can't see properly. The doctor recommended 4 points glasses. If I wear glasses, I can see things, but not clearly. Without them, I can't see at all. Number 4. I have unbearable pain in my eyes and brain. Number 5. 3 or 4 years ago, I had an eyesight issue. The eye specialist recommended glasses with 1.5 points. History. He had orchitis on the right side with very severe pain and discharge from the urethra, for which he underwent an orchidectomy on the same side nearly 5 to 6 years ago. He had a combined business with his brothers, which separated during those days. A party ran away with a large amount of their money, causing a great mental shock for him. I converted these details into the following rubrics. Number 1. Brain, senses, dullness of. Number 2. Mental ailments from mental shock. Number 3. Mind, torpor, mental. Number 4. Mind, dullness, mental. Number 5. Mind, confusion, sleepiness with. Number 6. Answers slowly. Number 7. Answers difficult. Number 8. Vision dim. Number 9. Limbs, motion of limbs difficult. And number 10. Male orchitis, infection of testes. You can see the remedy comes out gelsemium, and my prescription was gelsemium 1 ml repeated as required. In the second or third week after starting the medication, the patient began to have a black discharge from his nose, which continued for several days. After that, his health began to improve rapidly. In these videos, you can see how quickly the patient recovered.
महसूस होता है और ना कोई थोड़ी लेकिन ना कमजोरी काफी है। अच्छा, गाल समझ भी नहीं आती।
हाँ जी अरशद भाई सुनाओ की हाल है तबीयत का? कैसी है तबीयत?
कुछ बेहतर है पहले।
कितनी एक?
कुछ बेहतर है, ज्यादा नहीं।
अच्छा हुन उठ के चलदे फिरदे हो?
जी थोड़ा बहुत, ज्यादा नहीं।
थोड़ा जा हुन थोड़ा जा चल के दिखाओ हाँ भला। आ जाओ। कोई चक्कर चुक्कर तो नहीं आंदा? की हाल है?
ठीक है माशाल्लाह।
15 दिन कैसे गुजरे?
बड़े माशाल्लाह सुकून थे। थोड़े मैं से तो कोई फोन शोन भी नहीं किया कि कोई परेशानी कोई ना।
माशाल्लाह। ते अख दी जो सोज है हुन ते ये भी कम है?
जी ये कम है, लेकिन हजे नजर नहीं आ रहा बिल्कुल। अगे बिचू मन शक होता है भाई तू आ रहा है ना, लेकिन वो कोई नहीं आ रहा बिल्कुल। उंजे ही आक्स वगैरह भी नहीं नजर आ रहा है, साइड बिल्कुल नहीं नजर आ। बाकी दूए मामला जेड़े ना वो माशाल्लाह बेहतर है। भी सोजश मेरी लै गई है हम थोड़ी ना, काफी हद तक हम मैं टोर फेर भी ले गल बात भी हम माशाल्लाह पहले दिन निस्बत बेहतर है। गल है कोई गल जेड़ी करदा मैं कर लेंदा नहीं कि मेरी जबान रुक जाती है या नहीं, बेहतर है। और मैं दर्द वगैरह कोई नहीं।
चलना फिरना
ठीक है, वो भी ठीक है।
कमजोरी जेड़ी इस साइड ते महसूस
होती है अजे थोड़ी,
लेकिन ये के
पहले दिन निस्बत घट गई। अगे मैं टुरे नहीं जाता, हुन तो मैं माशाल्लाह निकल के बाहर भाग जाना, 5-10 मिनट 15 मिनट टोर के फिर वापसी आ जाना घर, बैठा रहना इतने भी चलता रहना।
याददाश्त कितनी एक ठीक है?
उन्हें काफी हद तक कोई गल होवे जिले मेरा जबान थोड़े रोक जावे तो नहीं तो तकरीबन मैं हर गल का जवाब सही दे लेना, वो भी समझ भी लेंदे सारे मामला। किसी टाइम जबान अड़ जाती है, नहीं तो उन माशाल्लाह ठीक है।
After his condition improved, I sent him to the eye hospital for an examination. Here is his report, which shows that his eyesight has also been restored. Thank you.
International publications, health talk shows, YouTube lectures, articles in international magazines, lectures in universities and colleges, training workshops, thousands of chronic and complicated cured cases, 25 years experience, homeopathic physician and author, Dr. Mir Zahed, D17 Islamabad. Contact and appointment 0333 670 6505.